In emergency medicine, you've got drugs that are absolute game changers, the ones that work so fast when every single second counts. Today, we're going to zero in on one of the most powerful and fastest-acting drugs in the entire arsenal, furosemide.
So let's just jump right in with a question. Picture this, a patient is literally drowning in their own fluids because of severe heart failure. What drug can you give them that starts to turn the tide in just 5 minutes? Well, you probably guessed it, it's furosemide. And in this explainer, we're going to break down exactly how it works, and just as importantly, why it's both a lifesaver and a pretty big risk.
Now, you've probably heard of furosemide by its brand name, Lasix. People often call it a water pill, but honestly, that nickname doesn't even begin to cover what this drug is capable of.
Okay, so what is it really? Furosemide is what we call a loop diuretic. Its job is actually pretty simple, but it's incredibly powerful. It basically tells your kidneys to stop reabsorbing so much salt, and when all that salt gets flushed out in your urine, a whole lot of water goes with it. That's the secret to its amazing effectiveness.
All right, let's really get into the nuts and bolts here, because the way this drug works is just a masterclass in biological speed and precision. It's fascinating.
So check out this timeline. This is what's so incredible. When you give it through an IV, furosemide attacks the problem in 2 ways. Get this, within just 5 minutes, it starts relaxing the blood vessels. That immediately takes some of the pressure off a failing heart. Then, maybe 15 to 20 minutes later, the main event kicks in, the diuretic effect, the massive increase in urination. It's like this incredibly fast 1-2 punch.
So how does it pull this off? Well, it's all about targeting a very specific spot in the kidney called the loop of Henle. You can see here, furosemide basically puts up a roadblock. It stops the body from pulling sodium and chloride back into the system. And with that pathway blocked, the body has no choice but to get rid of that excess salt, and a ton of water goes right along with it.
So you can imagine, a drug this powerful isn't something you use for a minor issue. Nope, this is reserved for very specific, very high-stakes medical emergencies. We're getting fluid off the body, and fast is the absolute top priority.
We're talking about truly life-threatening situations, things like acute pulmonary edema, where a person's lungs are filling up with fluid, or hypertensive emergencies, when blood pressure is so high it's about to cause major damage. It's even used in some cases to help manage hyperkalemia, which is when you have critically high levels of potassium in the blood.
But, and this is a big but, with all that power comes some pretty significant risk. Furosemide is the classic double-edged sword. Understanding its dark side is every bit as important as knowing all the good it can do.
In this slide right here, it illustrates that balance perfectly. On one side, you have the life-saving reasons to use it, but on the other, you have the absolute deal breakers, the contraindications. You would never give this to a patient who can't produce urine, or someone who's already dehydrated, or has dangerously low electrolytes. If you did, you could turn a bad situation into a fatal one, just like that.
Because furosemide is so good at its job, it can easily go too far. The most common side effects are a direct result of what it's designed to do. You can see a huge drop in blood pressure, hypotension, from all the fluid loss. And because it's flushing out all that sodium and potassium, you can end up with really low levels, or hyponatremia and hypokalemia. The drug is almost too good at its job, and that creates a whole new set of problems to solve.
And then there's this one. It's a really serious, though thankfully rare, side effect. If you push high doses of furosemide into the body too quickly, it can cause something called ototoxicity. That's a fancy word for damage to the ear that can actually lead to hearing loss. It's just a stark reminder of this drug's raw power and why getting it slowly and carefully is so important.
So how much do you actually give? Well, as you can see from this table, it's definitely not a one-size-fits-all kind of thing. The dosage is very carefully calculated based on a patient's weight, their specific condition, and of course, whether they're an adult or a child. Precision here is everything.
Okay, so for our last point, let's pull back and look at the bigger picture, because believe it or not, the story of furosemide is still changing.
Now this might actually be a surprise to you. For decades, furosemide was the go-to first-line drug for paramedics treating acute heart failure out in the field. But as our medical understanding has gotten better, a lot of ambulance services have actually taken it out of their protocols. They've realized that its powerful effects might actually cause more harm than good without the kind of close monitoring you can only get in a hospital.
And that really leaves us with this final thought.
Furosemide is without a doubt a powerful tool that has saved an incredible number of lives. But as we learn more and more about the body's incredibly delicate balance, you have to wonder, how will the role of this potent diuretic continue to change in the years ahead? It's really the perfect example of how medicine is never standing still. It's always learning, always adapting, and always evolving.